Welcome to Med About You, your health solution. 7 quick tips for fast constipation relief. Feeling bloated, heavy, or struggling to pass stool can be incredibly uncomfortable. Constipation is often caused by dehydration, poor diet, stress, or lack of movement. But the good news is relief can often come faster than you think with these simple, science-backed strategies. 1. Drink warm water first thing in the morning. Hydration is the first and most important step. Drinking a glass of warm water on an empty stomach stimulates intestinal movement, softens stool, and kickstarts your digestive system. Tip: add a few drops of lemon juice or a teaspoon of honey to enhance the cleansing effect. 2. Increase fiber intake gradually. Fiber adds bulk to your stool and helps it move smoothly through the intestines. Eat more fruits, like apples, pears, prunes, vegetables, whole grains, chia seeds, and flax seeds. Increase fiber slowly and drink enough water, otherwise, it can make constipation worse. 3. Move your body, especially after meals. Physical activity stimulates bowel movement. Even a 10 to 15 minute brisk walk after meals helps trigger peristalsis, the wave-like motion that pushes waste through your intestines. Try light yoga poses like wind-relieving pose, Padmasana, or child's pose to naturally ease constipation. 4. Don't ignore the urge. Many people suppress the natural urge to go, often due to busy routines. Over time, this weakens bowel reflexes. Try setting a consistent toilet routine, especially 15 to 20 minutes after breakfast when your body's digestive activity is strongest. 5. Eat natural laxative foods. Certain foods can act as gentle natural laxatives. Include prunes, kiwis, papaya, soaked raisins, figs, flax seeds, or olive oil in your diet. A spoon of castor oil, for adults, used occasionally and with medical advice, can also provide quick relief. 6. Try probiotics. An imbalanced gut microbiome can slow digestion. Probiotics help restore healthy gut bacteria and promote smoother bowel movements. Add yogurt, kefir, sauerkraut, kimchi, or probiotic supplements to your daily diet. 7. Relax and manage stress. Your gut and brain are deeply connected. Stress can directly affect bowel function and cause constipation. Practice deep breathing, meditation, or even a short walk outdoors to calm your mind. Your gut will thank you. These are the 7 tips of fast constipation relief, but many people asking about constipation. So basically,
what is constipation? Constipation is a common digestive issue characterized by infrequent bowel movements or difficulty passing stool. It is often associated with hard, dry, or lumpy stools, and individuals experiencing constipation may also feel a sense of incomplete bowel evacuation. While the definition of constipation can vary among individuals, a general guideline is having fewer than 3 bowel movements per week. What causes constipation? Constipation can be caused by a variety of factors, and its onset can result from a combination of lifestyle, dietary, and medical influences. Here are some common causes of constipation. 1. Low fiber intake. A diet that lacks sufficient fiber can lead to constipation. Fiber adds bulk to the stool and helps promote regular bowel movements. 2. Dehydration. Inadequate fluid intake can result in harder and drier stools, making them more difficult to pass. 3. Lack of physical activity. A sedentary lifestyle can contribute to constipation, as regular physical activity helps stimulate the muscles in the digestive tract. 4. Certain medications. Some medications, such as certain painkillers, opioids, antacids containing aluminum or calcium, antispasmodics, and certain antidepressants, can cause constipation as a side effect. 5. Pregnancy. Hormonal changes during pregnancy, as well as pressure on the intestines from the growing uterus, can contribute to constipation in pregnant women. 6. Aging. The aging process can slow down the digestive system, leading to a higher likelihood of constipation in older adults. 7. Colon or rectal issues. Structural problems in the colon or rectum, such as tumors or strictures, can cause difficulty in passing stool. How common is constipation? Constipation is a common digestive issue that affects people of all ages. Its prevalence can vary based on factors such as age, gender, and lifestyle. While estimates may vary, constipation is generally considered a widespread problem. Constipation is a global concern, affecting individuals worldwide. Its prevalence is reported to be higher in developed countries compared to developing ones. What are the symptoms of constipation? Constipation is characterized by various symptoms related to difficulty or infrequency in passing stools. These symptoms can vary among individuals, but common signs of constipation include 1. Infrequent bowel movements. One of the primary symptoms of constipation is having fewer than 3 bowel movements per week. 2. Hard or dry stools. Stools may become hard, dry, and difficult to pass. They may also be lumpy or appear as small, pellet-like pieces. 3. Feeling of incomplete evacuation. Even after a bowel movement, individuals may feel as though they haven't fully emptied their bowels. 4. Abdominal discomfort and bloating. Constipation can cause abdominal discomfort, bloating, and a feeling of fullness in the stomach. 5. Pain or discomfort. Some people may experience pain or discomfort in the rectum or abdomen due to constipation. 6. Rectal bleeding. Straining during bowel movements can sometimes lead to small tears in the anus, resulting in rectal bleeding. However, this can also be a sign of other conditions, so it's important to consult a healthcare professional if bleeding occurs. How can constipation be prevented? Preventing constipation involves adopting a healthy lifestyle, making dietary changes, and incorporating habits that support regular bowel movements. Here are some strategies to help prevent constipation. 1. Increase fiber intake. Consume a diet rich in fiber, including whole grains, fruits, vegetables, legumes, and nuts. Fiber adds bulk to the stool and promotes regular bowel movements. 2. Stay hydrated. Drink an adequate amount of water throughout the day. Proper hydration helps soften the stool, making it easier to pass. 3. Regular physical activity. Engage in regular exercise to stimulate the muscles in the digestive tract. Activities like walking, jogging, or yoga can help prevent constipation. 4. Include probiotics. Probiotics, found in yogurt and other fermented foods, can promote a healthy balance of gut bacteria, which may aid in digestion. 5. Limit caffeine and alcohol. Excessive consumption of caffeine and alcohol can contribute to dehydration, which may lead to constipation. Limit their intake. 6. Gradual changes in diet. When increasing fiber intake, do so gradually to allow your digestive system to adjust. Rapid changes may initially cause bloating or gas. 7. Consider fiber supplements. If it's challenging to get enough fiber from food alone, consider fiber supplements after consulting with a healthcare professional. 8. Maintain a healthy weight. Aim to maintain a healthy weight through a balanced diet and regular exercise. Obesity can be associated with an increased risk of constipation.
Thanks for watching. Please like, share, and subscribe.